Welcome. Thank you for joining in today and introducing your friend and your family to our program. My name is Hoang. I'm a board-certified plastic surgeon practicing here in Huntington Beach, California, and Phoenix, Arizona. If you know me, you know I'm a lifelong dieter, but recently I've converted to the skinny shot squad. So let's find out a little bit about these shots today, okay? Of course, we want to eat what we want and lose weight and never be hungry and never be craving anything. And these shots really are close to the magic bullet here. So this is not new. The shots are mainly made of GLP-1 hormone, which is glucagon-like peptide 1. It was discovered about 30 years ago in a lizard. This type of lizard only has to eat twice a year. Imagine that. After lots of research on animals and human, we have our first weekly injectable GLP-1 agonist, and this Ozempic semaglutide. This was approved by the FDA in 2017 for treatment of diabetes, then 2021 for chronic weight management, and very recently in 24 for reduction of cardiovascular events, heart attack, stroke. This is pretty huge. It's very safe and very effective at making people live healthier, longer lives, right? The second GLP-1 that joined the race were tirzepatide, Mounjaro. It's the first GLP-1 and GIP agonist. It got the approval by the FDA in 2022 for diabetes, and then again in 2023 for chronic weight management. There's many, many more as I'm told in the pipeline. We will have a lot of options. So how safe is it? As I mentioned before, this was the first one was approved was Ozempic, and it was in 2017. Before that, human trials started in 2013. So we have more than 10 years at this point of data, hundreds of clinical trials, thousands of patients. And in these clinical trials, patients are monitored extremely closely. So any bad, severe side effects are every single one of them are all recorded. And truthfully, these medications are extremely safe and tolerable. In 2023, just in the US alone, there were 8.2 million people on semaglutide, and the numbers just keep going up and up. Severe side effects are rare and can require hospitalization, but in my opinions, most of them are avoidable by appropriate pre-treatment workup and appropriate monitoring during the treatment. The long-term use is safe. So compound semaglutide and tirzepatide. These are what we offer in the clinic. These are the same active medications with the same active ingredient at the brand name Ozempic and Mounjaro. The reason why we even have access to these compound medication is because Ozempic and Mounjaro have been on the shortage list, FDA shortage list since 2022. Unfortunately, Mounjaro is now off the shortage list just a few days ago. What that means is access to compound Mounjaro will become more difficult in the next few months. Compound pharmacies have to meet very strict FDA standards and state requirements to manufacture these medications. So how does this GLP-1 work as magic, right? These hormones affect the brain, the stomach, and the pancreas. And we make these hormones naturally, but for some lucky individuals, they have a naturally high level of this GLP-1. And for some, their GLP-1 is inexistent, right? And GLP-1 increase the feeling of fullness when you're full in the brain, decrease your appetite, slow your stomach movement down so you don't empty your stomach so quickly. So you get fuller faster and you can't overeat. In the pancreas, this increased insulin, which help your kind of not have to help build the muscle, and then decrease glucagon, which trying to get more glucose into your bloodstream. So that means sometime to us when we're like not eating for a long time, when we have that glucagon respond and we feel shaky and we feel like we need to eat something right away, right? That GLP-1 decrease that respond overall. What that means to us is we eat less, we're less tired, we feel fuller faster, and we don't have cravings, right? We now can have time to make healthy choices. So in our program, we go up on the dosages relatively quickly. We don't follow the 4 doses at the lowest dose then 4 doses for the next. We increase the doses according to your response. And we can increase as often as every 2 weeks. And that's really get you to that happy dose where you lose weight without much side effects, right? And we really want to get you there fast because, you know, we're all want to see results. The one thing we emphasize is you have to exercise while you're on any kind of weight loss program. You have to exercise. You need to get into that exercise routine, especially in this case because we're eating less. So our body will need to use its reserve, and the reserve not always is fat, it's also muscle. So maintaining or getting into a good exercise routines really will help you maintain that muscle mass. And muscle mass is key to everything, to our health, to the way we move, to how well we feel overall, right? So exercise is really important. Healthy diet. And this sounds very generic, but when you're on the medication, you are not going to want to eat. And you're going to eat a lot less than you're used to. So you have to prioritize protein, right? Because protein is the building block of everything. So we have to eat minimum of 100 grams of protein a day to maintain, again, our muscle mass and our brain and everything else, to make sure we lose weight, but still stay healthy. Take a short medication vacation. Anything is, including weight loss, is good to take a little time off to let our body reset. A lot of time when you hit the plateau during your weight loss, doing this really, really helps. And then when you get there, you have to come off the medications, kind of slowly back off without giving your body a big withdrawal response, right? Because now your body is used to seeing a higher level of GLP-1. You want to encourage your body to make more GLP-1 by slowly coming off. So going down the dosage, going down the frequency, make sure that you maintain that goal weight. during a maintenance phase. And maintenance phase for most people is about 1 or 2 months. Some may need more, some may need less, but 1 to 2 months on average, you want to maintain that new ideal body weight. Weigh yourself regularly during the treatment as well as after, and just really don't hesitate to go back onto the program if you feel like you're slipping. So things that you may encounter during treatments with the medications, and we try to really minimize this in our clinic. We're very conservative in starting where we're starting you and how fast we're going up. But this does happen, right? Nausea, vomiting mainly happens in the beginning of the treatment. Probably have 2 out of 50 patients who experience this, and it's very unfortunate. This goes away as long as we don't push ourselves too much. A lot of time with the next dose, I have to either lower it or keep it at the same level. Diarrhea, constipations. Fortunately, we don't have any patients who have very bad symptoms in our program. And that's partly, I think, diarrhea and constipations. And you think, why would somebody have diarrhea and the other have constipations? It's everybody just respond to everything differently, right? Some people tan, some people burn. So these symptoms are heavily dose dependent, and most occurred at a higher dose, above 1 milligram, right? So if your happy dose is at 1 milligram or less, the chances of you experiencing this is very, very low. Dehydration. Fortunately, we don't have anyone with this, with major dehydration, but this is what can send people to the hospital. So it's very, very important. Myself, Helen, constantly emphasize that you have to hydrate, stay hydrated, especially during the beginning of the treatment. Tiredness, low energy level. This really happen when we go up on the dosage and it's a little bit too much for you. The increase is a little bit too much. Again, really rarely happen. I would say, 3 patients have reported this to us. But when it happens, usually short time limited, maybe a day after you feel normal again. And we just need to be cautious with the next dose so that it doesn't happen again. Plateau, we mentioned already, and how to combat it. And then the infamous or famous Ozempic face and Ozempic butt. Everybody's talking about it. Yes, I think if we lose anybody, if we lose weight, if we lose a lot of weight and we lose it very quickly, we will have deflation in our face, deflations in our body, maybe to the point where we feel like we need to have surgeries or stop losing, right? There is a lag between weight change and how your skin respond to it. So when I first started, within a month, I lost 6 pounds, and it showed in my face. But after 1 month passed, my face returned back to normal, and I actually like my face now more than before I lost the weight. Granted, I'm a plastic surgeon. I started minimally invasive skin treatments since I was in my mid-30s. So I'm maintaining a lot of that collagen. And we all can do that, right? The volume loss in the breast and the butt, not all can be corrected with just exercise. And we can talk about options. solutions, right? If that does occur and you want to stay in that weight, but you want fuller breasts or fuller butt. So we all can get to where we want with be patient and get to your goal weight safely. That's what I always say. It's more important that you can tolerate the medications and not rush than try to lose a lot of weight in a short period of time, right? Ideally, lose 5 pounds the first month, then 2 to 3 pounds every month. And with that, your body will have time to adjust, and it's a much healthier kind of weight loss goal than 10 pounds a month, right? But some people do lose 10 pounds a month. Exercise, exercise, exercise. Can I say that again? It's important for your health. It's important for your mind. When you start losing weight, this is the opportunity to take charge. You can move better, right? You could feel lighter. So do it. We could also treat ourselves to treatments that can boost our collagen and can boost our muscle. And surgeries are always there as the last resort. So if we could do squats and sit up and push up 100 of each every day, I do not think that we need to worry about Ozempic butt or Ozempic breasts. Unfortunately, most of us can't do that. So what's there to help? There's a lot of minimally invasive treatment that have basically no downtime. Like RF microneedling, we have Silpherm X in our clinic that can boost collagen in the skin. We have Evolve X, which is non-needle RF skin tightening, as well as muscle stimulations that can really give your muscle that boost and also help you also help with that collagen remodeling in your skin and tighten up the skin. Sometimes we combine the RF microneedling and the RF skin tightening to get even a better, more close to surgery result. There's also plasma skin tightening. This involved a little bit more of a downtime, but it's also extremely effective. Thread lifts can be used in the face and the body to tighten, to lift. And again, combinations of any of the above. We can get there. We can all get there. Other things you can do for volume if exercising is not enough, right? Breast augmentations or lift, fat transfer. Fat transfer is very, very powerful. It's a way to really sculpt your body, remove any of the residual stubborn fat, and put it where you want to put it. Can be your face, your cheeks, make your cheeks fuller again, like when you're young, your jawline. Can be your breasts, make it more lifted, could be your butt. For patients who are in their 50s, a lot of time they're already are considering facelift with weight loss. Most of the time, that's a great opportunity to rejuvenate yourself. Tummy tuck, thigh lift, arm lift, body lift. These, I would say that with the weight loss, it's rarely that you need to have these procedures just because you lose 20, 30 pounds, so even higher, as long as you lose it gradually, right? If you lose it really quickly, then yes. But a lot of time I have patients who are moms who already are very close to that verge of like, I want a tummy tug because that muscle is all loosened and destroyed, right? So with these patients, once you lose the weight, this is the best time to really kind of put the cherry on top, right? And get the surgery that you wanted even before you lost weight. And that's that.